amazing grace of God. It is an invasion of the sovereign love of God, penetrating the gap of darkness with the overwhelming power of His marvelous light. It bridges the gap between man and God. Take a journey through the amazing grace of God with your host, Sarah Abraham, as she shares the compelling stories of those who walked in His covenant and have overcome by the amazing grace of God. Join us weekdays this fall for Amazing Grace with Sarah Abraham.
Welcome to Amazing Grace. I'm your host, Sarah Abraham. We're so delighted you have tuned to us. We wish you have a wonderful Christmas and ready for the wonderful, blessed New Year 2016. Let's make a promise. Let's believe 2016 will be the year of victory. You overcome whatever you've been praying for years. Let 2016 bring you the answer to that. It's because of your support and your response we are able to come to you every single day with a program that empowers you, enriches you, and encourages you. We have such an amazing guest with us, Jenny Hrbacek.
Hello.
She is our former Mayor Dean Hrbacek's wife, a cancer survivor, and an amazing lady who's got a mission. And one of the mission is her book that she wrote, Cancer Free. Are you sure? With a big red question mark. And that's what we're going to be talking about today. Jenny, welcome to Amazing Grace.
Thank you. Thank you.
Tell us a little bit about your journey. When did it start? How did you find out?
Oh, goodness. Well, I'm excited to be able to tell people because I don't always get to be on Christian TV shows, but a huge part of this started 12 years ago when I attended a Bible camp in Hot Springs, Arkansas. And a gentleman that's a pastor there came up and he had a prophetic word for me. And he said, there is a work that you will do for the Lord and you will have a healing ministry. And I thought, what the heck is that? What is a work? I mean, most people don't even know what that word means. And I just kind of thought, well, okay. And then I ended up with cancer, and I thought, wow, Lord, this is some kind of healing ministry. I've got cancer. I mean, I'm the one needing healing. So through this whole journey in being diagnosed with cancer, I'd kind of just taken that prophetic word and set it aside. I did traditional therapy. I was diagnosed with cancer at age 47, 1.9. Yeah, 1.9 centimeter tumor. I went to the doctor every year. I was always fine. My CBC was fine. My blood sugar was fine. My cholesterol was fine. No signs of anything.
Mammogram was fine.
Everything was fine. And I'd actually waited a year for my mammogram. But when I went and they tell me I have cancer, people say to me, Jenny, you wrote a book on cancer. No one wants to know they have cancer. And I say, I beg to differ, because when you are told you have cancer, the first thing you ask is, how bad is it? You want to know if it's stage 1, 2, 3, 4. And then I took the question a step further and I actually said, how long have I had this? Because I thought, I've been going to the doctor, I feel fine. I feel fine until you just gave me this news. I didn't even know I had a problem.
How was it discovered?
I just went for my yearly checkup and my doctor just thought she felt a cyst.
Oh, shoot.
So I went and had that checked and it was not a cyst.
They did a biopsy.
Yes, yes. So I went through all this horrible, it's all of a sudden you aren't given options, you're given lab slips and orders. Go get this echocardiogram, go get this stress test, go get this lab work. And you're standing, go make an appointment with this plastic surgeon and this oncologist, and you're standing there with all these papers and you don't know what to do other than do what the papers say. So I ran around and did what the papers said. It was the worst year of my life, the absolute worst year of my life. And I wrote this book because I don't want anyone else to go through what I went through. And it is absolutely, in my opinion, preventable.
Yes.
And I tell people how to intervene much earlier. Because what really was my set-off point was when I asked how long had I had this, and they told me 8 to 10 years. And I said, I've had this for 8 to 10 years?
8 to 10 years before it was discovered.
Yes. I said, how could I have had this for 8 to 10 years? Because my physicals are always fine. I went home and I dug through old lab work, my white blood cell count, my red blood cell count, hemoglobin, everything's fine, but yet I have cancer. And I thought, surely there's something not right here. And then I got my nursing magazine in the mail because I'm a registered nurse a few months ago, and it had Mapping the Human Genome. And the Lord just said, we can map the human genome, or humans can map the human genome, but yet we wait for cancer to grow for 8 to 10 years to show up, to be big enough to show up on an imaging test. Does that make sense to you?
No.
It doesn't. We can send a text message from Florida to California, but yet we wait for cancer to grow. Yes, we wait for cancer to grow big enough for people to basically have one foot on a banana peel. You've got a problem if you wait for it to grow that long before they detect it. And I thought, how can this be? Surely we can find cancer earlier. Anyway, and that's what
that's what set off this in motion. Tell us a little bit about your experience, you know, when you mentioned some of the things that you have learned just on the internet to your physicians, your oncologists. How was their response?
Well, you know, you have to understand, when you go to the doctor, you're looking for a prescription. Doctors are doctors of pharmacology. And when you come in with the symptom, you're asking them most people want to leave with a prescription, some kind of drug or something that they can take to fix that. And usually if you leave with nothing, you're kind of upset because you didn't get a prescription.
$30 copay and nothing?
Right, and doctors don't have, there's no coding for them to say that they did nutritional counseling with you, or that they told you anything about lifestyle. They cannot bill for that. So, you know, through my whole process, while I was sitting in the chemo infusion room, I did do 4 doses, not 4 rounds, but 4 doses of chemotherapy. I was watching the people in the chemo room, and you know, there was a kid sitting across catty corner from me one day, young man, and he had a recurrent brain tumor, and he's eating Nutter Butters and a Snickers bar, and you know, and his chocolates, and he's got a diet soda, and I'm thinking, what, you know, surely this guy wants to live. He came in here, he's getting chemotherapy, but he's eating this.
And nobody's telling him anything better.
Right, if your body is faltering and you don't have proper nutritional status and your immune system is faltering, you need to be shoring up your good guy, shoring up your good army so you can win this battle. All of that just got me going, and I ended up going to a breast cancer support group after I finished my 4 doses, and they told me I was fine.
Surgery and chemo.
Yeah, and I just figured they were just going to watch me. And at that meeting, it was the first meeting of a new group that had come together here at one of our local hospitals. And there was a huge group of ladies, 40 or 50 ladies were there that day. And I was so excited to come. I had even brought some friends with me. Hey, we're going to have this support group. But my whole bubble was just burst during that meeting, because every lady went around and introduced herself around the circle and told what kind of cancer she had. And there were even a couple of guys there, and what therapy she had. And the more I listened, I realized, God, these people pretty much all had the same cancer I did, estrogen, progesterone positive. But the scary part was, Sarah, was that half of them, and about 50% of them, had had a recurrence. And they had wigs again, they had scarves, and they all thought they looked great. But I'm thinking, this is not good. And they've got the mugs with all the rhinestones on it and the pink ribbons, and they're all singing the praises of their physician. And I'm thinking, but you're also vomiting, and you have mouth sores, and you know, you've got cancer now in your liver and in your bones. And I'm thinking, this cannot be good. But all of these ladies were told they were cancer-free after their treatment, because we want to believe so much when we go to the doctor that they're going to cure you. But the word cure is never used. But in our own mind, we hear those words and we think, oh, the doctor's going to cure me. They're giving me this is the protocol, and this is going to get rid of the cancer.
I'll be
but
cancer-free.
Really, it's just a treatment. And a treatment is not the same as a cure, because if chemotherapy...
Treatment is masking the symptoms.
Well, and if chemotherapy was a cure, it would be in the newspaper. We would have we wouldn't have 1 out of 2 men and 1 out of 2.5 women getting cancer, and so many deaths of cancer. If they had a cure for it, which they don't. They
still don't.
But we want to believe it. Everyone wants to believe that their doctor is the best, they're getting the best care. Anyway, so I looked at these women and I thought, dang, do I have a target on my back? And I literally set up and I go like this. And when I go out and speak, I have a PowerPoint and I have a big red and white target with an arrow. And I felt like I had a target on my back. I thought, somebody's not telling me the truth. And everything I do, I try and really base in truth. I try not to add to, take away from anything. I just give me the facts. I'm a very factual person. And something didn't sound right. It just didn't sound right that all these ladies had a recurrence. So from that, I decided that I was going to build up my immune system, because we know that when you have cancer or you have arthritis or you have any kind of a degenerative disease, the immune system is faltered.
Yes.
And with cancer, God created us with an immune system, and we have things called natural killer cells and phagocytes, and these things are like little garbage disposals, and they're little cells, and they're supposed to gobble up the cancer.
Gobble up the cancers, yeah.
But in my body, they saw the cancer as normal, so they didn't gobble it up, they just let it grow. And that's what happens in other cancer patients. That's how the cancer continues to grow. But the phagocytes, they're kind of sleepy, and why are they not working? And so I decided I was going to build up my immune system. And I left Houston because I'd already been through 3 oncologists. I'm good at firing doctors. I've decided that you have to be an advocate for yourself.
That's right.
You really,
Nobody knows your body like you do.
You really have to. And I tell people, don't get so wound up because someone has a white coat with blue letters, because they are victims of their education.
That's
so
right.
you better make darn sure that you are happy with the education they received. Are they just a doctor of pharmacia, or are they a doctor that's going to look for the root cause to help you heal? But a lot of times those doctors, you have to pay extra. For, because insurance isn't going to cover for them to really look for the root cause. They're going to pay for scans and prescription therapies and surgeries and that sort of thing. Anyway, so I went to Dallas, and I walked into a clinic, and I said, hey, I want, nice to meet you. It was a gentleman by the name of Ray Hammond. And I said, I want to build up my immune system, because he said, why are you here? I'm like, well, I had cancer. And this was amazing what he said to me. He goes, well, let's make sure you don't have cancer. I said, oh, no, I don't have cancer. And he said, well, how do you know? I had the same response when I asked that question to people. Well, I have clean surgical margins, and I have a clean PET scan. He goes, so? He said, bear with me. Would you just humor me? Let's test and make sure you really don't have cancer. This was the first time I learned about something called circulating tumor cells. I had no idea. I didn't understand why someone can have colon cancer. They cut out the tumor, they get clean surgical margins, and months or years later, the person turns up with cancer in the liver or somewhere else. And it's like, how did it get there? They had clean surgical margins, they removed all the tumor, the PET scan was clear. Because cancer cells are very vascular. That's why thermography is great, because it's looking for the heat. If you do a thermography picture, you'll get the red spots versus the blue spots. You can find cancer years earlier just by doing a simple thermography. But I tell you about tests even stronger that are, I think, even more precise than a thermography, because thermography will lead you to more testing, but it's a great test to do. So anyway, he told me about circulating tumor cells. And every tumor over 2 millimeters, we know, has a pretty good network of vascular access, because the tumor has to eat, right? It can't just live in your body encapsulated. It's got to get nutrients. And so as the blood goes into the tumor, it's a process called angiogenesis. The tumor will actually grow its own little blood supply. And if you've ever seen a tumor exteriorly on somebody's skin, you will see these purple lines that grow out from it. It's just a wicked looking thing. I think it's from the pit of hell, cancer. I just hate it.
It is.
Anyway, but cancer cells can get swept away in the bloodstream. And so they give you all the chemo and the surgery and the radiation, but they leave you with these
free radicals floating in your blood.
Yes, with these cells, and that's how it ends up setting up shop in another
organ or
part of the body. So I did the test, and it turned out I had 14.2 per 7.5 cc's of my blood. I had a lot of cancer circulating, and it was, if anyone is a diabetic and you have a little insulin syringe, if you put all my blood in insulin syringes, a little 1 cc, I had over 2 cancer cells in every syringe. Now, I don't think I had that much before the surgery and the chemotherapy.
You did not have that.
I don't have a test, because no one offered me this test. If I had had this test 5 years ago.
And what is this test called?
That was an RGCC OncoCount. And I tell you in my book what phone number to call, how to find a doctor, how to get it. It's a great test for seeing if your therapy is working, if that circulating cell count comes down, or to find cancer early. You can find it before you even know you have a problem with that test. But the situation was that I had these cells, so I needed to get them down, or I was going to be just like those women in that support group that had the recurrence. So and I just told Dr. Hammond, I said, you're kidding me. I'm just like those ladies. And it's like the light bulb came on.
Just waiting.
And then I decided, oh my gosh, I have to tell more people about this. So I get home from Dallas, I'm on the phone, I'm calling everybody I know that's had cancer, telling them, you have to go get this test. You have to go get this test. I don't want you to get cancer again. You've got to get this test. You've got to stay on top of it. I know, but they're like, oh, my doctor says I'm good. I see my doctor every 6 months. I said, well, I'm not living that way. I'm not living from appointment to appointment, waiting for some doctor to declare me cancer-free.
And
God is
then
my
you
God,
don't know.
and He knows my life. He created my body in a miraculous way, and I know that it can heal. But I have to do my part. I obviously sowed bad seed. You know, we live in a very, very toxic world. It was very estrogen dominant, which, you know, my cancer was estrogen positive. Just lots of, I take responsibility. I weighed 25 pounds heavier at the point when I was diagnosed, so I've really had to change a lot about my life. But the good news is I did the RGCC test, and they have a bunch of different tests. You can go on their website and look. But I did their full test, the Oncostat, and it told me all the natural substances that I can take that were effective at creating cell death or stopping that angiogenesis, that blood vessel production for cancer. So I'm not running out buying different supplements that don't work for me. I use the ones that work for me and at the highest percentage. And it
kind
also
of tailored towards you.
Yes, and it also told me what chemotherapy I would take if I was to do chemotherapy. And of course, the ones I did weren't very effective, which we know because I have these cells. So for the last 6 years, I've been testing that regularly to get my numbers down. Yeah, once a year. When I first got the diagnosis, I did the therapy program. I went to a physician and I did intravenous vitamin C. I completely got off of sugar, changed my diet, sweating. I just did everything that my tests recommended. And in 6 months, I got it down to 2.9, which is, stable disease. You can live with cancer. You can manage it. No one wants to. But the worst part is not to know that you have it and it's growing silently in your body. I feel like these doctors that I was seeing stole valuable time from me. Because at every checkup, no one ever said, hey, you should, there's this testing out there. Well, I've only told you about one test. There's so many other ones. I'll tell you about a couple of other ones. But if I had known earlier, I wasted valuable time where I could have intervened. Because we all know that when you find cancer early, the chance of the body healing is so much
better. So much better. And then your immune system is not so shot with all this chemotherapy.
Right, and see, then I damage you can never poison someone to death, to health. You just simply cannot do it.
Chemotherapy is poison.
It is poison, and there is a time for it. Sometimes you just have to knock it back, but then you better not stop there. That's my message. Do not stop there. And if you decide to go traditional route, please, please, please get an RGCC after and make sure that they really got all the cancer.
Now let me ask you this, Jenny. If you had known what you know now, how would you have treated your breast cancer diagnosis?
Very, very, very differently. I've been attending the IOICP conferences for the last 3 years. In the last 2 years, I've been a speaker. I'm going to be a speaker again at their public session this year. But it's called the International Organization of Integrative Oncology Physicians. And I tell everyone, if you get cancer, go onto their website and click on the Find a Physician tab and find someone who can work with you to heal the body and get rid of these cells. So what I would have done, I'm not against surgery. Sometimes there is a time for surgery to remove the tumor burden, but you still have to fix the body. Cancer is not something that's just right here. You take it off. Everything has blood flow. We know that. I don't know why we think that attacking the tumor is going to get rid of the problem. The tumor is a symptom of the problem. And I didn't understand that. I didn't understand circulating cells.
Okay, so you would have surgery, and then what kind of treatment?
Well, and let me tell you something that was about my surgery was the reason I did the double mastectomy with the reconstruction, but they showed me these beautiful pictures. I thought, oh, that looks okay. And I'm never a person that believed in any kind of plastic surgeon, but when you need one, you need one. And I was desperate.
Yeah,
so
me too.
So I got a good one. Yeah, so I got a good one. But I told every doctor I talked to, the reason I was going to do the mastectomy is I didn't ever want to have to deal with breast cancer again. All I did was keep the cancer from coming back in the tissue that went in the trash can. That's all I did.
And most women think like that.
Yes,
Most
they
women
want to
think
just get
like
it
that.
off. But
Get it off.
the science shows that there was absolutely no increased lifespan from a mastectomy versus a lumpectomy.
Wow.
And
So, you know, Angelina Jolie, she did.
She
And
did.
she didn't even have cancer, but she had
did. She didn't know about my book.
that, what is it called?
She
Brachy something.
Yeah, she had a BRCA positive.
BRCA
Less than
positive.
5% of the women with breast cancer are BRCA positive, which means there's something other than BRCA that's causing breast cancer. If 95% of the people with breast cancer are BRCA negative, BRCA is not causing breast cancer. It's just you have
So it's just the 5%.
less than 5%.
Less than 5%.
Of people with breast cancer are BRCA positive. She could have done a test called Oncoblot. She's got the money. She could afford to do the test once a year, once every 2 years. Oncoblot's an amazing test because only cancer cells and viruses put out this ENOX2 protein. And if you're positive for the ENOX2 protein,
Then you know.
Then you have a problem. What they can do is, I'm sorry, I'm talking about nagalase. I'm confusing me. Let me go back. Nagalase is put out by viruses and cancer cells. Cancer cells are the only thing that put out the ENOX2 protein. Oncoblot tests for that. They have a website. I tell you how to get the test. In my book, I tell you the benefits and limitations. That test is $850, but they are going through FDA clinical trials right now. And I'm so hoping they get approved. But the cool thing about it is, if we took a pen and we put a little dot on my finger, that test, as well as RGCC, can find cancer when it is that little tiny, that small, which is about 2 million cells. That's enough ENOX2 protein for them to get a positive. And then they can test the osmolarity point of the ENOX2 protein, and they can even tell you the site of origin of the cancer. If it's breast, if it's thyroid, if it's prostate, if it's one of the 27 cancers they can identify, they can tell you. And you can go down to a big hospital and get a scan, and they won't even find it. They won't be able to find it, it's so small. And these integrative oncologists will work with you and get that test to convert back to negative.
With nutrition, exercise.
Yes, and maybe some immunotherapies, kick up your immune system. You know, it depends on what.
Okay, you said surgery could may be an option, but what kind of treatment would you take?
I would not do chemotherapy again.
No chemo?
I would not.
How
I would
about
have
radiation?
oh my gosh, no. The people that give you the radiation are wearing the apron, and they have the little tags that when they get
Monitors, yeah.
Yes, it's very, and it kills the tissue. But what did we just talk about? That cancer cells are circulating in the blood, and so killing and burning the tissue in that area doesn't do anything but make that tissue very difficult to heal from a cut or an injury. Okay, with that said, I want to just address quickly, people say to me, Jenny, but doesn't everyone have cancer cells? And so when they say that to me, I say, oh, well, when are you starting chemo? And they say, what? I said, well, you just told me everyone has cancer cells. And they said, well, yeah, that's what I read. I said, okay, the difference is, yes, the body makes cancer cells every day. Your immune system will gobble them up and throw them away. You should not be able to have enough cancer cells in your blood to pick up a positive ENOX2 protein, to pick up a positive thymidine kinase level, to pick up a nagalase level, to pick up circulating tumor cells, all the different tests that I talk about in my book. You should not have, cancer should not be growing and replicating in your blood.
Okay, so what is the one thing people should cut out? I mean, simple thing, if they don't want to get cancer.
You have to have clean living, and it's more than just one thing. You can't eat processed foods. You have to look up.
And I think about 40–50% of America is eating processed food.
Oh, more than that. I'm sure it's more than that. It's you know, when the Industrial Revolution started and we started processing our foods, we started processing sugar, up went the cancer rate at that time, and it's never come down. It's never come down.
Even with all this healthy living and organic stores and whole food and everywhere, we are still eating more processed food than any other country.
Yes, yes.
And like you said, and you see that cancer is much more in the developed countries.
Yeah, oh, absolutely, absolutely. People didn't get cancer years ago. You know, there's a dentist named Weston Price that traveled the country. He's a dentist, and he actually went to all these tribal countries that did not have American, or not American, but white man or processed food. You know, they were the Indians. And anyway, when they started getting the processed food, they started getting cavities. They had not birth control issues, but infertility issues. The jawbone here got narrow. The teeth got crooked. I mean, everything
every
changed.
kid needs braces, right?
Yes, every kid needs braces. But when they went to those same tribes and they took back the white flour and the processed sugar, the next generation, the mouth, your jawbone widened back. The next generation had straight teeth.
Yeah.
God didn't say to Adam and Eve, eat of the tree, eat of the fruit of the garden and brush your teeth 3 times a day. We are eating really bad food.
That's why we have to brush our teeth 3
We
times a
have
day.
to brush our teeth because we're just full of bad bacteria. We don't even have the same gut microbiome that we used to have. We kill it off eating processed.
Then we reintroduce it by probiotics and all that
We
stuff.
We try to, get back what's killed.
So
every
processed
day.
food is one thing. And it's not that easy to eliminate it 100%, but we can cut it down, really cut it down.
Yes, you can. Yes, I love green juicing. I love, fresh salads and smoothies. But it's difficult and it requires effort.
Effort and work, and people don't want to work.
But because they don't know they have a problem. If doctors started ordering for everybody who came through an RGCC or an OncoCon or even just a simple Nagalase level, people would have the motivation, I'm hoping, to make the changes necessary to keep our body healthy. But we're living in deception. We think everything's fine until we hit that wall and we have a problem. And then all of a sudden we're like, oh my, we're in a panic mode but we've had the problems for years. The body just doesn't get cancer one day. Doesn't just get arthritis one day. Doesn't just get diabetes one day. These are all processes. And we test for diabetes. We test people's blood sugar. But I don't understand why. I think there's a lot of money in cancer therapy and huge money in all I tell you in my book, a way to get a low dose chemotherapy if you really want to do that. It's called insulin potentiated therapy. I read a whole chapter on it. There are things you can combine.
Alternative centers? You see these cancer centers, alternative medicines. How do you rate
Some
them?
say they're alternative, but they're not really.
No, they're not really.
No. No, they're not. They just say they are because they have a dietitian. And sometimes the dietitian at the hospital I went to needed to go back to school.
So she never mentioned any of those green juicing or fresh vegetables?
She was still using the pyramid, the food pyramid, which we know has made us all sick.
Food pyramid, that's
the standard American diet.
thing.
Yes, right. It's kind
Nothing
of
has
upside down.
changed.
No, nothing has changed. But that's what she's taught in school, and that's what they have to teach because that's what's approved. So, God created, he said, eat of every tree. He said the leaves of the tree are for the healing of the nations. But we're not eating the leaves we're not eating all the herbs, and everything is so processed. And there are nutrients in all these different herbs and plants and just curcumin and, the quercetin, just that connection right there. And the vitamin D is so immunostimulating, vitamin D, and helps upregulate the phagocytes. There's so many things that the basic nutrients that we get if we ate things in the form of which God created, instead of processing our food, I don't think we would have all the sickness that we have. Even yeast. There's so many anti-yeast things, grapefruit seed extract, and there's so many things that if we would get in our body, they would help to keep things in homeostasis, but we don't get it.
And so actually, our physicians, our nutritionists, our dietitian is not really teaching us. And I think these should be taught even in schools.
Yes.
To young kids.
Right.
I mean, wherever you look, there's nothing but vending machines.
Yes.
What do they carry?
That's what they
More
had in the
sugar.
chemo room where I went.
I read that in your
Yes.
book, and I said, oh my God.
It was a terrible vending machine with Oreos.
And we are fighting for the, vending machines in schools to have not sodas, but alternative drinks without all the sugar. And you said it's in the chemo room.
Yeah, it's in the chemo room. It's just, I don't even know how, I don't understand why doctors are not using this testing. A lot of them are. In fact, the group that I go to conference with, they're all using these tests. Every one of them. For $85, you can get a Nagalase level.
Yes.
And Nagalase
And sometimes it's worth spending the money. That
Yeah.
$85 is well worth the money. If your insurance doesn't pay for it, forget it.
Right.
I would do it other than get cancer and then spend millions of dollars and being sick.
Yeah, people tell me all the time, oh, I can't afford to go see that doctor. I'm like, but you don't understand. One diagnosis of cancer can financially devastate you. financially devastate you because you don't realize you have deductibles and copays,
Copay.
time lost from work, pain and suffering.
And
The
then
pain and suffering is so, I can't even put a value on that. It's so, the cost is so high.
And that just the fear,
Yes, and the fear.
depressions.
Yes.
And, you know, if you're a young mother and you have young children, I mean, what are you going to do? Who's going to take care of them?
Right. And this can be prevented. Just get an
That's the
agalase
sad
level.
part.
Get an
Nobody
alcoblot.
tells
Yes.
It can be prevented.
Right.
Jenny, thank you so much
Yeah.
for being on this show.
Sure.
And thank you for sharing this valuable information, things that we can do to prevent cancer.
Absolutely.
Things that we should do if we are diagnosed with cancer.
Right.
We are barely able to touch it. I know the next segment we're going to do on the nutrition, where prevention and care. So keep watching. And till next time, keep walking in that amazing grace of God.